Good evening. Welcome to Balance Orlando in Orlando, Florida. My name is Arthur Gillespie. Today is the second Rolf session of our 10-part Rolfing series. We worked last week on the first session, and I'd like Debo to talk about what she experienced afterwards in terms of pain, in terms of mobility.
Okay, well, so first of all, I didn't drink enough water. And all day, before and after. So the next day I felt sore. So that's a note. Make sure you drink plenty of water. But I also actually felt more mobility when I was sitting at the desk. When I was working, I was able to sit up a little bit straighter because you'd done some work in this area, and I also
And
just
and you mean when you say this area, you mean the middle
the
back or the
middle
lower back?
the middle back.
Okay.
And as far as the hips, it's hard for me to notice mobility more in the hips or whatever, but it just felt better. Like I was talking about how this side was tighter.
The right side.
The right side was tight, and it I didn't feel that tightness anymore. So there was definitely some positive results from the hip work there. So
Okay. I'm just curious, when you did the 10 series 10 years ago, did you do any exercises between the sessions, like using a foam roller, especially with the hips?
I did nothing. I wasn't even working out back then. I walked. That was what
Okay.
I did.
Okay. Well, walking is probably one of the best
Yeah.
exercises, especially during Rolf sessions. So as we know, we're going to be working with Rolf session 2, and this involves working with the feet and the ankles and the lower legs. And one of the goals today is to unwind, untwist the fascia of the bottom of the feet and slowly going up into the lower legs so that we can have a lot of splaying. And when that happens, we get more grounding of the feet. And when we have more grounding, we have more stability. And this is one of the goals I'd like to achieve today is both a feeling of having more stability, but also more range of motion. And when you have that flexibility, yet strengthen your feet, you are less prone to sprain an ankle or have knee injuries. So those are my goals today. And what we're going to do right now is a walking analysis followed by a bent knee test. Look at your arches, and I noticed a slight pronation in both of your arches, especially your inner arches, as you were walking. So this is something that I will review even more when we do the bent knee test, which will be right now. And so you're going to stand right here, and I'm going to have you pretend that you're at the bar method and you're reaching out to an imaginary bar, and your hips are there's a slight bend in your knees, and you're gently going to bend your knees, not all the way to the ground, but about halfway to the ground and back. And what I'm checking for is first your arches, and then second, the tracking of your knees. So we're going to do this a couple of times. And here we go. Good. Come on back. And good. And last time. Good. So let me show you and explain to you what I've see so far. So when you're bending down, like I experienced when you were walking, there's a slight pronation, not too great, but just a slight pronation in your ankles when you are bending your knees. And also at the end of you going to the ground, there's a shift in your pelvis going to the right,
Yeah,
like a wave.
a little wobbly, so
But from that point of starting almost to the end, it's nice and straight, and then it gently goes out to the side. So you're going to do the same thing facing me though.
Okay.
Good. And here we go. Good. And coming back, and two more times. Good. And last time. And what I'm looking at right now are Debo's kneecaps to see if they're pointing forward or if they're going out or if they're going in. And what I like is that they're going straight. and I'm happy about that. So let us begin. We're going to come onto the table, and you're going to place your head right here. You're going to be on your back, and your feet will gently dangle over the edge of the table. Okay, so Debo is now on the table. I've checked her head placement so that her head is not tilted forward or back. She's in a nice horizontal plane. And I'm looking at her legs in a natural state, and I see a lot of symmetry in her legs. I see the kneecaps. If I were to take a laser, they would point straight up to the ceiling, and the feet primarily are not everted and not inverted. They they feel very good, at least on the inner heels and the outer heels. And there's nice movement when I take Debo's legs in and out. So the first thing I like to do is just kind of cup my hands underneath, close my eyes, and just see how much each leg weighs. Is one leg easier to pick up than the other? And what I'm feeling is the right leg, from just closing my eyes, is a little bit lighter than the left leg. And just wanted to confirm that with you, or did you even feel a difference?
I sometimes feel like my right leg is a little wobbly or weaker, so maybe that's the case.
Okay.
I don't know that I'm aware of the weight difference, but
I feel the weight difference primarily in the lower part of your quadricep when I raise your left leg. And what I like to see is the legs as like independent units, so that when you're walking, your legs are not like log cabins, but they're actually like a slinky from the 70s. And when you have that slinkiness, you're moving more efficiently with the least amount of effort. So the one thing I did feel is that when I just grip the bottom of the heels, that there is more tightness and probably some more discomfort on the left side of the inner heel versus the right side. And typically when that happens, the tibialis posterior, which is just off the edge of the tibia towards the inside of the legs, is most affected by the soreness in the inner heels. So I'm going to work the right leg first, the leg that doesn't need as much attention as the left side. We kind of leave the side that needs the most attention last. Since the bottom of the foot is the beginning point of the fascia that goes towards the back of the body, I like to just do a couple of strokes. And I know you're sensitive, like last session.
God, but that feels so good.
With
I think the best foot massage ever right now.
And I'm imagining, can I make the shape of a banana by doing this? We'll just do this 2 more times. We're just going to first say hello to the bottom of the foot, but also kind of just to warm up the bottom of the foot. And so from the bottom of the foot, that fascia goes on each heel to the Achilles, the calf muscles, the hamstrings, and then the gluteal muscles. I'm just going to do this a couple more times. Do you know if there's more tightness on the outside, Debo, or on the inside?
I think on the inside.
Okay. And now working on the outer heel, is there more tightness on the outside or on the inside?
On the outside.
On the outside. Okay. So if it's more tightness on the outside, it means I need to address more of my attention on the outer muscles, the peroneal muscles of the lower leg. So what I like to do is to encourage movement during the Rolf sessions. So I'm going to make sure the tibia is pointing forward. Dr. Rolf used to say, take the tissue where it needs to go and call for movement. And for about 30 seconds, Debo is going to gently dorsiflex and plantar flex. Now, I know that you've been driving a stick shift. So I want you to just do this motion for about 30 to 45 seconds and tell me if there's been any issues with the bottom of your feet lately.
On my left foot, which is my clutch foot, I've been having a tightness in the heel that actually makes it kind of tender when I walk. I'm not sure if it's a little bit inflamed or if it's just so tight that I'm kind of stepping on the knot, you know. I'm not sure what it is, but it's noticeable. I've been doing some calf stretches that help, but it's not like it used to be.
Okay, is this every time that you drive a car or every time that you drive a car for
No,
more than 20 minutes?
so I don't actually feel it until I'm walking on the foot,
Hmm.
but it's only on my clutch foot that I feel it.
Got it.
So I think that something about the way I'm pushing and moving my foot for the clutch might somehow be aggravating it. I don't know.
Do you know if that affects the left knee at all compared to your right knee?
Oh, I never thought about that, but I mean, I am moving that leg more and pumping it more, so it probably does.
Thank you. Okay.
You know, I guess I really only noticed it in the ankle because that's where I feel some discomfort. So I'm not the ankle, the heel. But it wouldn't surprise me if the knee was affected as well.
When I'm doing my test, I typically like to have in the lower leg the tibia to be right in the middle, and I like to support Devil's calf muscle with my left hand, and with my right hand, I like to go on the outside and just to see if there's any difference between this from 3 minutes ago to right now.
There is. It's a lot less. I mean, it's still tender, which lets me know it's still tight, but it's a
Hmm.
lot less tender than it was.
Okay. So we're going to just do one more minute on it's called the interosseous membrane, inter meaning between, osseous meaning bones. And I'm going to it's like we're going to be walking on our back only with the right foot. So I'm going to put my thumbs right on that interosseous membrane, which is just right off the edge of the tibia. And we're going to go for a walk. And you're going to tell me if there's any discomfort as I go up to the knee.
It's like on the verge of being ticklish,
Hmm.
but I'm not actually laughing. So if it's discomfort, it's very very mild. Mostly I just feel stuff moving.
Where is it moving from and to?
Um, it just like whatever the fascia or whatever that's under your thumb as you're moving, I can kind of feel it sort of smoothing out.
Yes. Okay. Thank you. So we know that if there's tightness on the front of the body, the majority of times there's going to be tightness on the back. So one thing I'm going to be checking for
That's the worst
is,
finger there.
thank you, is what's happening in the calf muscle and making a mental note of where there's tightness. So she mentioned there's a tightness right in here.
Yes.
I'm going to be looking at what's happening in the calf muscle. And yeah, there's a lot of tightness here. My fingers are kind of pointing straight forward. And I'm going to be working on both the calf muscle to help to elongate it by being in a dorsiflex position and then come back. So lengthening on the back side of the calf muscle and shortening
I feel like that's
on the
gonna
front
be.
side.
I feel like that's gonna be even more challenging on my left leg.
So where do I find tightness in Devil's right lower leg? About right there, right in the middle.
Yep.
Up until the middle, up and from the bottom of the knee, or the bottom of the knee to halfway down Devil's leg was pretty smooth until we got right here.
Ah,
So just make a mental note. So before and after you stretch, you address your calf muscle and right on the front side of your interosseous membrane. We come back down, it's still tight, and I'm still pushing her foot forward in a dorsiflex position. And I love to do ankle circles. So tell me if there's any soreness. I'm right on the bottom of the Achilles tendon on the lateral side.
it's a little bit tender, but it actually feels really nice.
Okay. Again, I'm doing this because I want Devil to have not only a very strong foot, but a very supportive foot and a foot that has a lot of range of motion. Now, I'm right now right below Devil's lateral malleolus or ankle bone, and we're doing some ankle circles. And tell me if there's any discomfort or ticklishness right where my thumb is.
It tickled at first when you put it there, but now it feels pretty good.
Okay.
Actually.
Good. And now, again, testing out if there's any tightness on the outer heel.
It's even way less than it was. Holy cow. What a difference.
And I'm actually putting more pressure into Devil's ankle.
Wow.
So if you just before a workout or at the end of the day, just spend 3 to 4 minutes with a tennis ball on the bottom of the foot, or you can sit down, cross one leg over the other, and self-massage the bottom of your foot and work right on this tibialis, or excuse me, the interosseous membrane. It's going to make a big difference. Okay, so now still feels a little bit lighter than the left foot. And now I'm going to ask you, Devil, any soreness or tightness in the inner heel?
It hardly anything. It feels so much better than it did.
Okay. If you were to have any tightness, typically it would occur on the inside of the tibia. So I'm going to work there briefly.
It feels so good right now.
So right now it feels very good from the inside malleolus, inside ankle bone. I feel a little resistance here.
Yeah, but it doesn't. Okay, there was like a little point of.
Right there.
Yeah.
Mm-hmm.
Oh God! But again, I feel it moving. It's amazing.
Now, would you say if this pressure light, moderate, deep?
I'd say it's moderate.
Okay. I ask Devil that question because many times people will tell me Rolfing is painful. And then when I ask them, well, when was the last time you were Rolfed? They become quiet and say, well, I just heard it was painful. So we have an actual person on the table, and I wanted to ask her what her experience was.
You know, my experience previously too is that it's more like a good workout kind of feeling than pain.
Mm-hmm.
I mean, there's some discomfort that I have to breathe through, but if I breathe through it, then it's just the same kind of discomfort you get when you're kind of fatiguing your muscles in a good workout, you know. And once you get through it, it feels so good.
Okay. Now, as I gently just pull Devil's ankles, I wanted to find out from you, Devil, is it still more tightness on the right side or left side versus the right side? What's the difference in sensation?
I definitely feel tighter on the left leg.
Okay.
I mean, definitely feel like the right leg is a lot looser.
So right now,
it felt longer when you were tugging on it.
Okay. On both sides? Or?
No, on the right side it felt longer.
Okay. There are two sheaths of connective tissue. I call them rubber bands. And they are almost like a rubber band where the flexors and extensors of the lower leg go through these two holes, one above the ankles, one below the ankles to go into the foot, which gives you the ability to dorsiflex, plantar flex, invert, evert, and roll the ankle. So I like what I'm feeling. I'm going to come back to the foot and see if there's any difference, if it feels like I can make the shape of a banana even easier. And we're going to also check.
Wow, that feels so much easier. Like, before when you were doing it, I was having to breathe a little bit
Yes.
through it because it was so tight. It feels so much easier now.
So right now I'm on the inside, the medial arch of Debo's right foot. And just starting from the heel and just slowly going up to the big toe.
Feels so
So anytime you're going to do a 5K, 10K walk, race, it's nice to massage the bottom of your feet as it it activates all the connective tissue on the back side of your legs. Okay. So as I have you here, Debo, we were talking about this previously, can you talk about your, if this can be classified as a bunion or not?
Oh, yes, definitely.
Okay.
It has been diagnosed as a bunion officially.
Okay. And how long ago was that?
Believe it or not, I think I was like 19.
Okay. When this typically happens, there's a crowding of the fascia between your first and second toes. And what I like to do is kind of hydrate that fascia. So I like to give the peace sign to your first and second toes. And then with my thumb, I like to go right in that groove. And this might be a little painful, might be a little bit of discomfort.
A little discomfort, but not painful.
And I'm working both on the front side and the back side. I'm using kind of like my middle finger to work on the back side of the bottom of Debo's foot. For most people, the most pain is not on the front side when I separate the two big toes, but on the back side.
That's where it would be for my mom. But
Okay.
make sure you repeat what she says to you.
So you were saying that you've been diagnosed with this right bunion for some time now. What I feel, though, is that the foot has pretty good expansion. Like I'm making pizza dough and I'm imagining a line right down, imaginary line right down the middle of the foot to the third toe, to this toe right here. And I'm just gently trying to spread it out like pizza dough. And it feels very open. The only spot where it might be a little tight is in the medial arch between the heel and the middle of the foot. But this is what we palpated several minutes ago. Checking out Debo's flexion, extension, inversion, eversion, and I like what I see. I'm just curious, you have really good extension. Did you ever dance as a kid, take ballet classes or jazz, tap?
Very little.
Okay,
It might be because I did do yoga for a lot of years.
okay.
It's the most.
So you've been doing yoga for quite some time, which has helped you with the spreading of the foot. And all I have to say is keep it up. So what we're going to do right now is to slowly get off the table and we're going to take a walk and I want you to compare the difference between the right foot and the right lower leg to the left foot.
Okay.
And we're going to walk one more time. I saw something, I'm not sure if you felt it or not, but I will let you walk to the door. And come back. And before I say what I want to say, have a seat and tell us what you have experienced walking twice to the door.
So I wasn't looking at my feet or
Okay.
anything, but I had the sensation that my foot was probably pointing more forward than off to the side and doing it like without me having to force it. Um, it generally felt looser. My leg felt like it was moving more at the knee as well as the hip.
Good.
And it felt really nice. My foot just felt really soft almost.
And may I add that when you were walking, I saw less of a pronation on the right foot
I don't
versus the left foot.
It's interesting. I think I just don't recognize it, and it's weird because I have a lot of body awareness and I'm aware of all these other things, but in my foot, I don't seem to be aware of that pronation. So I didn't notice that it wasn't there as much. So, but I definitely felt more loose and flexible, and and this leg feels so tight by comparison right now. It's crazy.
And is it tight all over or mostly in the knee or just from the
Um,
foot to the hip?
it feels tight from the heel up to like just like the lower thigh area, really.
Okay.
Yeah,
All right.
right about here.
Okay. Mid thigh
Yeah,
before it starts to feel back to normal
yeah,
to the hip.
yeah.
So now we are going to have Debo back on the table, back on her back, and we're going to work on her left foot. Okay. So Debo has come back on the table, and I'm closing my eyes and I'm just gently gripping the bottom of her ankles, the heels, and already the right side, the right foot that we just worked on feels more narrow. And the left side feels either more muscular or has more inflammation. So, one thing I recommend for those people who might have a swelling in their ankles is, at least for temporary relief, is before you go to bed and you've finished meditation or during meditation for 10 to 15 minutes, that you can place one or two pillows on top of the bed so that the heels can actually be higher than the heart. And then what will happen is any fluid in the ankles will drain to the heart, and from the heart will dispense of that excess fluid where it needs to go. So that's something I would recommend. And you can tell me how you feel afterwards
Okay.
when I see you next time. So right now, as Debo was speaking, I was working on the bottom of her foot, making the banana, and I felt that it was a little bit harder to make that banana, and it was tighter from the heel to the middle of the foot. And I wanted to know, Debo, what your impressions were.
So it's actually similar to the situation last time with my shoulders, where the tighter side, I don't feel you as much because it's so much tighter. You know what? Does that make
I
sense?
do.
Now, as you're digging a little deeper, I can feel some of the stuff moving around underneath you, and now I'm starting to feel the pressure more, and it's a little bit more intense.
Okay. Do you know if it's tighter on the medial side, the inside of the foot, or on the outside?
I would say the inside,
Okay.
because I felt you on the outside right away, but it took several strokes for me to feel you on the inside there.
Okay. And what I'm feeling is kind of like a bubble wrap,
Yeah, it's
like a
crunchy.
packaging wrap, and it's crunchy. And I rarely felt that
Yep.
on Devil's right foot, but definitely on the left foot.
Oh, I feel it too.
So the next path that the fascia takes from the bottom of the foot are in the ankles. And what I like to do before I do a exercise or a long walk is just to massage the inside of my knee, of my heels, and say to myself, is it tighter on the inside or on the outside? And Double, I ask you this question, is it tighter on the outside or on the inside?
It feels tighter on the inside, or it feels more tender on the inside. So,
Okay. So it feels more tender on the inside, which means I will work and spend more time working on your inner legs than the outer legs, than your peroneal muscles. But like the right leg, we're going to take the tibia where it needs to go, and I'm going to call for movement so that you're going to flex flex and extend for about 45 seconds to a minute. And as I work, I can already feel that Devil's interosseous membrane on the left leg is a lot tighter.
Oh, yeah.
It's a lot harder to get inside and push down into that cartilage which connects the tibia and fibula.
Right there.
Again, in the middle of the lower leg, we have a lot of tension and a lot of tightness. And we're going to do that again.
Okay.
Here we go.
It's like a workout.
And again, if at any time my pressure is too much or too little, please let me know. And I really like the way you're breathing into that part of the body that is very tight in your body.
That felt tight going into the ankle area too there.
Okay. Tell me what's happening on the bottom of your foot. Does it feel the same as it did 2 minutes ago?
It's not crinkling as much.
Mm-hmm. So although we're working on the bottom of the foot, the beginning point of the fascia, which leads to the Achilles tendon, to the calf muscles, the hamstrings and the gluteal muscles, to the lower back. Sometimes when we work on the balancing side, we can also see a lot of progress, which is what I'm experiencing. And you'll notice throughout our sessions, I might be working on a particular stroke of the body on several occasions. It's to see if the previous work that I've done on that particular portion of the body was actually helpful. So now I'm going to feel both the outside of the heel and the inside of the heel. And tell me how the inside of the heel feels.
It doesn't feel nearly as tender as it did.
Okay. What I'm feeling is that I'm putting more pressure
Wow.
in your inner heel, and this is a good sign.
Oh, wow.
So right now I'm working on Devil's inner heel, but in a flexed position. And this is probably the most tension for you. If I have you in a plantar flex position, you probably are not experiencing that much discomfort. Would you agree?
Correct. I mean, it's a little bit still, but it was definitely more intense when it was flexed.
Okay, so we come in a flex position, a lot more tightness.
Yep.
So this time, instead of working Devil's inside leg muscles, I'd like to work above and below the ankles. And what I'm feeling is that the upper part of the ankles feels like there's a little bit more either muscularity or inflammation. It just feels bigger, just by a little bit compared to the right side. So what I'm doing is I'm adding water, I'm hydrating this upper band of fascia, and then we come to the lower part of the ankle and do the same thing. And what I'd like to ask you right now, Debo, is if there's any discomfort right below this lateral or this lateral part of your ankle.
Tiny little, like, sort of pinpoint where I can feel it.
What I'm seeing and palpating is that it's a little bit harder to get inside of Debo's lateral ankle, and there's also less range of motion.
Yes, I can tell that difference too when you're like I can feel the muscles resisting you when you're moving it around. And on my right foot, I didn't feel that.
Thank you.
There, it's tender.
Okay. So if I know it's tender on the front side, I need to look at what's happening on the back side. And I can tell already there's a lot of, there's going to be some discomfort right here because it's harder to like get inside this nook right underneath your Achilles tendon. And tell me what you are experiencing right now. Is there more tenderness on the back side of your Achilles tendon on your left foot versus the right foot?
Yes. Yeah, it's definitely different.
The beautiful thing about doubles fascia and structure is that through medium to deep pressure and movement, we're able to affect very positive change in a very short amount of time. And what I could ask Debo to do is for her to make her own ankle movements. So let's go 2 more times. 1, and I like how you're making very long, wide circles, and reverse.
About that.
2 more times. And stop. You were saying before we started that there were some issues in your left leg. Could you repeat that to our general audience?
And, for my left foot,
And especially your left knee. Excuse me.
um,
Any surgeries there? Any?
well, yeah, I had a calcium deposit. I had a bone injury, and my body started like depositing too much calcium on my knee, and it became like a little knob.
Okay.
And they were worried it was going to actually cause like a deformity in my knee. So 2 out of 3 doctors said remove it.
Okay. Was
And
this on the inside of your leg where they
yeah,
removed it?
yeah, I have a
Okay.
scar on the inside there, and they pretty much, they pretty much like cut like straight down to get to it and to cut it off. So like the skin and the muscle are kind of still 30 plus years later, kind of um, tender or not tender, but a little like numb in that area.
Okay. Did you have any instant relief after the procedure, to your
Um,
knowledge?
oh gosh, it was so long ago. I
Hmm.
mean, my leg was, I was in a wheelchair for 2 days with my leg immobile. I wasn't allowed to bend my knee at all,
Yes.
and then I was on crutches for a while. So I don't think I was aware of. I mean, the bone tumor was gone. I didn't have any pain associated with it. They were just worried it was gonna like push my knee joint weirdly.
Okay.
So I don't know that I noticed any relief. What I did notice was that it was weird. I had to kind of relearn how to walk on my left leg again.
Well, you've done a really good job since that procedure.
Thank
So
you.
thank you to your parents and thank you to yourself for being vigilant to doing the exercises to match your pattern when you're walking on your right side. As you've been talking, I've been working the upper part, this upper rubber band, the fascia above and below the ankle, and still on this outside
Yeah.
part of the lower part of the ankle. I still feel a resistance. And what I'm doing is I'm making sure that the foot is not everted or inverted, but it's neutral.
Yeah, but I feel that.
And she's going for a walk only on the left foot, and my chest is representing the ground. My stomach is representing the ground, and I'm making sure that when we dorsiflex, that the foot is not going out or in. So now, let's check what's happening on the outside of the foot. Can you tell me how that feels on the outside heel of your left leg, of your left foot?
Um, it feels a lot less discomfort than before.
Okay. And now let's talk about the left inner heel. We have not really worked there too much, especially on the lower leg. But can you tell me?
It's way less discomfort.
Mhm.
I mean, that was really, I had to breathe hard while you were working on that. And now,
Now it feels a little bit
oh
better?
yeah, I mean, I didn't have to do any of that heavy breathing.
Good. I'm just going to spend just another 30 seconds right on the interosseous membrane because I am a perfectionist and I want to find out those tight spots again, just so that when Debo leaves and she's going to do her 6 a.m. workout tomorrow, 5 days a week, she can massage those parts of her shin and calf muscles that are tight to begin with. So as I progress from the heel to the knee, can you tell me where you experience discomfort and a tightness? Right here. So I'm going to look at what's happening on, place my fingers on the balancing side on the calf muscle, and we're going to go for a walk. So I'm taking my bottom fingers and trying to lengthen as we dorsiflex and contract with my top finger. Good. Now let's gently come up and you can tell me where there might be another interesting spot to work on.
There.
Right here.
Yeah.
So I'm going to come up on my bottom hand right here and go do the same exercise about 3 or 4 times. 2 more times. 1 and 2. And then let's try to go up. Okay, so there are those 2 spots.
Yeah.
Please remember them. And then remember the balancing spots on the calf muscle. Okay, so now I'm going to compare the left and right side. And already I feel a lightness in the left leg that I wasn't experiencing when we first started this evening. I still feel a little bit more tightness, more muscularity, more inflammation on the left inner heel, but
it's so much better than it was, though, when you first started working on it.
I can actually take my fingertips and press deeper, easier. And I was comparing the lightness of Debo's right leg and left leg, and I was saying that the left leg feels a lot lighter, especially in the lower part of your quad, and this is an area we did not even work on. But you can see how when you work the bottom of the feet and the heels and the calf muscles, it's like a ripple effect. You'll start to feel this in your gluteal muscles, in your hamstrings, and even in your lower back. So remember, as I stated before, if you had a very long day of walking or driving a long time or sitting, when you're meditating or just watching TV or just right before you go to bed, you just take 1 or 2 pillows, elevate the feet for 10 to 15 minutes, let that fluid drain to the heart, and sleep peacefully. So now I'm going to work in between the toes like I did on the right foot. And what I see is that I don't even think there is a bunion on the left toe, big toe, compared to the right toe.
I mean, there's a little bit of like the starting of one, but it never got so bad.
Okay. Has it been classified as a bunion?
No.
Good. So what we can do, we're going to make that peace sign. I like to take either 1 finger, I like to take 2 fingers, make some space, and with my thumb, give that crowded fascia, crowded connective tissue, some love and attention. Sometimes we see people with bunions and you'll see this, and you ask them what kind of shoes they wear, a lot of times they might say high heels or shoes that are a little bit too small. So it's not the case all the time, but in the majority of cases that I've been Rolfing, that's been the case. Do you wear high heels?
Not when
Okay,
very rarely.
okay. And now I'm working on the back side. And already when I'm working on the back of the foot, I don't feel that resistance and that tenderness and discomfort that I experienced on your right foot. So this is good. So I'm going to compare last time, picking up the heels. They feel good. They're pointing forward. The feet are pointing forward. The kneecaps are pointing forward. We're going to now come off the table slowly, and we're going to take a walk. Okay, so Double, I'd like you to walk twice to the door and back. Good. And can you tell me what you're feeling in the left foot and lower leg as you walk back to the door?
Well, first of all, I just wobbled a little bit. Sorry, that was balanced. That wasn't my walking. First of all, I feel like the tenderness in my heel is a
The,
lot.
the outer heel, the inner heel? The inside heel?
The bottom.
Oh, the heel.
Yeah,
Okay.
the heel.
So the left heel, right here.
Yeah, the tenderness in my left heel feels a lot less. So that's good. And then, can I do this again?
Please do.
So they both feel like they're moving, but my left leg still feels a little tighter. It is, isn't it? Like, do you see it?
Not really, but as you walk again, I'm going to share with the audience what I see.
Okay, because what I feel like is my right leg is pointing more forward, my right foot is pointing more forward, and I feel like my left foot is still kind of going off to the left.
And what I see is that the left foot is kind of curving. I'm going to show you I'll be very slow. I'm exaggerating how the foot is kind of kicking out. There's less of a pronation compared to 45 minutes ago when you're walking. One other good thing I see is that the inside of your legs, especially the adductors, are not touching.
Right, okay.
So that's something I could hear, but I could also see. But yes, there still is more pronation on the left side, on the left inner heel versus the right side. How do you feel in the left hip? I know we haven't worked there yet.
The hip feels loose.
Okay, so what we're going to do right now is get on the table. But before we do, I just want to explain that there are some ankle rotation exercises that we can do so that that foot can land even straighter with less pronation, and those notes will be provided in the video when it comes online.
All right, cool.
So let me ask you this. Is there more tenderness and tightness on your right side, your right lower back, right hip, or the left side?
It's my right glute area that gets the tightest. It's always my right, and it's mostly in the glute and kind of leading up into the lower back.
Okay.
Into the side of it.
So,
yeah.
Okay, so Debo was pointing mostly to the right gluteus maximus from the upper part to where a lot of the attachments go.
It usually feels like the way it feels like it starts here and then it kind of travels up is how it feels. So, I don't know if that's how it works. Okay, it's tender here, like right there, it's tender, but I feel like the tension, like it's like the glutes kind of clamping down.
So tender on the upper gluteus medius and maximus, but the discomfort starts right in the middle. So that could be the piriformis, it could be the gluteus maximus, and we're going to show you also at the in the notes to the video an exercise to reduce the tightness in the piriformis as well as reducing the pain. So since the right side hurts a little bit more, we're going to work on the left side
Okay.
first. Oh, sit.
Oh.
So now we're going to transition into you being on your right side.
Okay.
But let me set up the table. Debo is now laying on her right side, and this is going to allow us to work on her left hip, working on the upper part of her iliotibial band, her tensor fascia lata, her gluteus maximus, the upper gluteal muscles, and the gluteus medius. And I want to apologize in the beginning because Debo is very sensitive. So I'm just going to put my hands here to introduce my hands to her gluteal muscles.
Very ticklish.
You are very ticklish, so I'll be very sensitive. We conclude many Rolfing sessions working with the hips as they are a transition to the next session. So this session we work the feet. The hips are the transition to work on the third Rolfing session, which is working on the sides of your upper body. So the first thing I'm going to do is take your hips into an anterior tilt and a posterior tilt and see if there's any spot on the gluteal muscles which is very tight. And I don't feel that tightness. Do you feel a tightness, Debo?
I think where one of your thumbs is, it's a little, yeah, there.
Right there.
It's a little ticklish.
Okay. So we are right now on the gluteus maximus. Okay. Any soreness or tightness at the tensor fascia lata?
There's probably some tightness because it's ticklish, but it's not so bad.
Okay. So what I'm going to do right now is I'm going to palpate I'm going to just gently raise your shirt up,
Sure.
gently feel your last rib and the hip. And so I'd like to see a little bit more gap between the last rib and the hip. So one thing I like to do is I like to make the shape of a triangle with my hands and just gently see how easy it is to take with this, not the elbow, but the ulna, just gently try to take that hip away from that rib, her last rib. Tell me if this is tight, if this is painful, if this is sore. Can you tell our audience?
It's ticklish. If you, actually, if you are able to press a little more, it'll feel less ticklish.
Mm-hmm. Good. And so my direction now is working on the upper gluteal muscles and slowly going more medial to her spine.
The breathing is helping me not laugh.
So now what we're going to do is we're going to pretend that we have glued Debo's heels together, and she's just going to gently raise up about 3 or 4 inches just to contract the muscle of the gluteus medius and back down. Good. So we're gonna do this. We'll do this for about 6 or 7 times. Okay. And so slowly come up. That's all, and back down. And up. Good. And back down. 2 more times. And last time. Thank you. I'm going to recheck.
Okay.
I'm going to recheck the ability to take Debo's hip on an anterior tilt and a posterior tilt. So it feels very good. The only bit of tightness I feel is right here, and that's more between gluteus maximus and medius.
Yep.
So what we're going to do right now is gently lift the knee up and down. One more time. And then this last time, I want you to keep your knees together, and I want you to extend this top leg.
Like that?
Just like that. Good. And come on back. And again. So I'm glad Debo is laughing because many people experience different reactions as we work on the fascia. Some people will cry. Some people might get very angry. Some people become very quiet. Like Debo, I laugh a lot. Good. And we're going to do this 2 more times. And what I'm doing with my right thumb is gently taking that thumb and taking it more towards her feet so that we can get more space in this hip from the lower rib. And come on back. Okay, I'm going to check your last rib again. So I've seen probably like about 3/4 of an inch increase of a gap between your last rib and your hip.
Okay.
Just one more time, and you don't have to move at all. And I really am thankful that you're taking a really good breath and you're breathing in those parts of your body that I'm working on.
The only way to avoid that ticklish response.
And what I'm feeling right now is that I'm sinking into Debo's gluteus minimus, medius, and maximus a lot easier. Still, the tight point, which is between the maximus and medius on the upper part of your left hip. So I want you to extend just 2 times. Very good. 1. Good. And 2. And relax. Okay, so we are going to transition to laying on your left side. We are now working on Debo's right hip, and Debo has explained to us in this Rolf session that she is more sensitive in her right gluteal muscles, especially in her gluteus maximus and the piriformis, which is even deeper than the gluteus maximus. So I'm going to apply a little bit more pressure so that Debo doesn't have a laughing fit. And hopefully this is a little bit better, Debo. And I'm going to now check the ability or the ease of taking Debo's hip into an anterior tilt and posterior tilt. And Debo, can you tell me what you're experiencing?
So to me, it's less ticklish, but that's usually because it tends to be tighter. So, I'm ticklish when the muscle is like on the verge of letting go. And right now it's so tight. Like I feel, you can tell me, Arthur, but it feels like it's moving less than the other side.
It's actually moving about
The same?
a little bit. No, it's actually moving a little bit less, but compared to most people, it's moving extremely well.
Oh, okay.
But you are correct. It is tighter than on the right side, the side I'm working on now, than on the left side.
Yeah, because it feels, I feel discomfort without feeling ticklish, which is usually a sign of it being tighter, harder to get in there.
Okay. So right now I'm palpating with my left fingers the last rib and the hip. And like the left side, we need to create more space.
Right.
So I come in with my triangle, applying a little bit more pressure so Debo doesn't laugh as much, and gently take that hip away from the rib. And what I'm experiencing is that the right hip is a little bit harder to take away from the rib than the left side. Debo, what is your experience?
Oh, yeah. It definitely feels more intense.
Mm-hmm. So now what Debo's going to do is place both of her heels together.
Oh, yeah, it came apart, sorry.
That's all right. So that I ask her to pretend like we've applied glue to her heels, and you're going to gently raise your right knee, just 3 to 4 inches. There you go. That's all. Come on back. And again. Good.
Feels harder to raise it, actually.
It feels a little bit harder.
Yeah.
Okay. Three more.
Like more effort.
Okay. Takes more effort. So just 2 more times. 1 and 2. Good. Thank you. We're going to check on Devil's anterior tilt and posterior tilt. And like last time, the results are amazing. There's a lot more. There's less resistance and easier ability to take your hip in both directions. This is important because if we have tight hips, it means we cannot take the fullest stride. And that usually leads to a lot of tension in your hips and in your knees and in your back. So we're going to raise your right knee up and we're going to come back down. I'm now feeling the trigger points, not on her upper gluteal muscles, but more in the middle part of your right glutes.
Wow, I feel that.
Is it more discomfort or?
It just, I don't know how to say it. It's a little sharper, I guess.
Okay. Good. And what I'm doing is I'm taking my hands in almost like in a counterclockwise position so that Devil can get longer muscles in her spine and also in her glutes as we create more space between the last rib and hip. Just good. Now I want you to extend your leg, keeping both the knees together, and extend this lower top leg. Excellent. Good. And again. 4 more times. Three more times. Good. 2 more times. And last time. Thank you. Come on back. And now we test again. And let me tell you that it's moving a lot easier and I'm really sinking in.
And I'm laughing more, which is a sign that it's loosening up.
You're laughing more because it's a sign of you feeling, say that again?
It's loosening up because I can feel you more, which means that the ticklish response happens.
Okay.
So that actually means it's loosening up a little bit.
Thank you. So last time before we conclude, gently trying to take the outer part, the gluteus medius, and the upper part of the gluteus maximus away from that rib. When we have long muscles, we don't have that compression, we don't have that contractedness in the muscle fibers, which means less tension and more ease in moving and standing. Last time. Good. And now I'm going to find your last rib. Good. And already we probably got about a good 1.5 1.75 inches of space between the last rib and the hip. Now we conclude with a sacral cradle. So that means I'm going to have you on your back. We conclude Rolf session 2 with a sacral cradle. So we have Devil laying on her back and her head is supported so that her head is horizontal, her chin is horizontal to the ground. And we're going to ask Devil to place her feet on the table. And I'm going to place my right hand underneath the sheet, underneath your sacrum. So I want you to gently raise your hips and come back down. Good. And what I'd like you to do is to take 3 deep breaths, 3 nice inhales through your nose, 3 exhales through your mouth, and we're going to start the breath right below the umbilicus, the belly button. So a nice inhale through your nose, all the way to the crown of your head, and exhale through your mouth. And 2 more times. Good. So do not raise your hips at all. I want you to gently extend your feet. And last thing I do in raw session 2 is, since we've worked with the feet, is to gently cup the back of the heels and see what it's like especially on the inside of the heels. And what I'm experiencing is a reduction of muscularity and or inflammation in your left heel.
Yeah, it feels so much better than, it was so tender when you first started on the inside of my left heel, and just now it felt like hardly anything. So it's much better.
Excellent. What we're going to do is do a post analysis where you're going to come off the table and we're going to do a walking analysis, and then I can share with our general audience, and you can share with the general audience what you're feeling now from the heels, the bottom of the feet, the lower legs, and the hips.
So much better. Okay.
Which heel feels
My
better?
left one. Remember, it's so tender. It still feels a little tender, but it's obvious to me that it was a soft tissue thing because it feels so much better based on the work you just did. Is that all on camera? Sorry. Awesome. Okay.
So we're going to walk twice to the door and back. So the first thing I see is I'm not seeing the swinging out of the left foot as much as I did just about 10, 15 minutes ago.
Again, I think that's also because the heel feels better, so I'm putting more weight on it, I think before it was so tender, I was kind of avoiding walking on it.
And also I'm seeing on the left Achilles, it's pointing forward, it's not pointing out. Let's just walk one more time.
Sure. Feels great. My goodness.
And I'm also seeing less of a pronation on the left foot as I saw when we first started.
It's still doing it a little bit though,
A
isn't
little
it?
bit,
Yeah.
a little bit. So just know that if we do those ankle rotation exercises, that's going to help us go from heel to toe and with less of a swing on the outer part of our foot. And our homework for next time is to walk.
Okay.
I call it conscious walking. I don't want you really to do this when you're outside, but you could take a book. It could weigh like a tenth of an ounce. And we're going to just go about half the speed to 3/4 of the speed.
Look at you go.
And we're going to work on looking forward, but also having a nice abduction in the hips. And when we abduct from the hip very easily, we take a very long stride. So I encourage you not to do this outside,
Right, yes.
but you can do this in the privacy of your own
But it's
home.
not fair. You have a little flat spot on your head. I don't, so.
So, Debo, I want to thank you for Rolf session 2.
Thank you. It's great.
All the best, and I'll see you soon.
All right.